Hello, I'm Dr. Shari Nemeth, dermatologic surgeon at the Mayo Clinic, Arizona, and I specialize in the treatment of skin cancer. There will be more than 1 million cases of skin cancer diagnosed in the U.S. this year. That's more than the number of cases of lung, breast, prostate, and colon cancer combined. Fortunately, the most common types of skin cancer, which are basal and squamous cell carcinoma, are rarely fatal. However, if you leave them untreated, they can become very destructive, eroding into the underlying bone, muscle, and cartilage and leaving a patient severely disfigured. The majority of these cancers occur on the head and neck, and for those tumors, there's a special type of surgery called Mohs micrographic surgery, which I perform. Mohs surgery is a specially designed, microscopically guided surgery technique that enables me to take just a small layer of skin around the biopsy, take it to the lab, and then look at it under the microscope and determine if there is any skin cancer remaining in any of the surrounding skin. If there is, I continue to go back and take layers as needed until all the skin cancer is out. Once the skin cancer is out, we'll discuss the best way to repair the surgical defect. Now, once you've had a skin cancer, the likelihood of getting another one in the next 5 years is about 50%. So half of my patients will come back to me in 5 years. The best way to protect yourself is to be conscientious about sun protection, because we know that skin cancer is related to sun exposure. Now, many of my patients say we don't go out in the sun anymore. However, even though 20% of our sun exposure is before the age of 18, over 50% is after the age of 40. So sun exposure and sun protection continue to be very important long into our life. The way to protect yourself: 1, get in the habit of wearing a sunscreen every day. Put it next to the sink and apply it before you go out in the morning. I recommend using an SPF 30 or higher. Number 2, if you're going to be out for more than 2 or 3 hours, be prepared to reapply. If you're a golfer, make sure you keep your sunscreen in your golf bag, and before you, if you're playing 18 holes, before you turn around and do your back 9, reapply. If you're playing 9 holes, apply when you're finished with your game. Next, if you do not like wearing sunscreen, or if you want added protection, there are wonderful sun protective clothing lines out there which provide a high level of ultraviolet protection with breathable, comfortable fabrics. If you're somebody who likes being out in the water, consider buying yourself a swim shirt or a rash guard. Finally, it's important to keep track of your skin. If you notice a spot that's not healing and hasn't gone away, it's probably something your doctor should look at. And then finally, consider the ABCDs of moles and melanoma when looking at your skin. The A is for asymmetry. If you have a spot and you cut it in half and the 2 halves don't match, that's something your physician should take a look at. B is for border. If the border is irregular, it's cloud-like or jagged, again, that's a spot that should be looked at. The C is for color. If there are multiple shades of brown, specks of red, white, blue, or pink, that's something else that should be looked at. And finally, D is for difference. D is the most important letter, and you want to know if any spot is different than the last time you looked at it. Is it a different shape, size, color? Is it different because it itches? Is it different because you don't have any other spots that look like it? Or is it different because you've just never seen it before? If you keep track of these few things, you'll do well in preventing yourself from getting skin cancer. Thank you.